Hey everybody, this is Eric again. My name is Eric Ottinger, recovery rebel, revolution, licensed professional counselor, licensed clinical addiction specialist, clinical trainer, and mindfulness-based stress reduction teacher. This video is going out really in particular for the clinicians in the Charlotte and surrounding areas. If you work in a community mental health agency, if you work in an addiction treatment center, this is where I spent my early career. And when I say early, I'm really talking about 6-7 consecutive years. And so I've got a great deep personal connection with serving and treating that population. And I also know how extremely hard and difficult and challenging and stressful it can be to work in a community agency and be burdened with unpredictable caseloads and masses of bureaucracy and administration and paperwork and hoops to jump through and a constantly changing system that is really, really frustrating for everybody involved, clinicians, the clients. And so what this really is an attempt to reach out to those of you that might want or need some help. And I'll really start with this, that early in my career, there was a shift where I was able to and entrusted with running a 5-day-a-week treatment program for people with co-occurring disorders. And when I took that over, I really realized that I needed a lot of help. And so I reached out for some training outside of the area, was willing to travel to do that. And so the first thing I did is I drove about 250 miles out of the state to go and do a multi-day seeking safety training. And some of you might be familiar with that program. It is the go-to gold standard for people with PTSD and substance use disorders combined. And I trained with one of the national trainers there, and I also was working with a lot of people that my clinical director at the time would say had personality disorders, substance use disorders, lots of trauma, so probably very familiar to many of you that might be watching this. And so I reached out to get some additional training with DBT, dialectical behavioral therapy. And so that was 6 years ago that I did my first DBT training through the staff at Duke. And so what I've done over the last 6 years is I've really maintained that relationship with Duke and one particular individual, and kind of really adapted my style, my way of thinking that is very DBT centric, but also just really could be described as contemporary cognitive behavioral therapy, mindfulness-based cognitive behavioral therapy. I've also done a significant amount of training in ACT, acceptance commitment therapy. I have trained in mindfulness-based cognitive therapy, and I am a qualified mindfulness-based stress reduction teacher. So if you are looking for a better understanding of mindfulness-based contemporary cognitive behavioral therapies, DBT and ACT specifically, I am a NAADAC trainer, and I do deliver NAADAC CEUs for ACT, DBT, motivational interviewing, seeking safety, illness management recovery, and 12-step facilitation. If you are struggling, if you are stuck, if you just need some help, if you want to ask a question, I am happy to talk to local clinicians and assist in any way possible. If you need consultation, supervision, or training, I am happy to provide that as well. So there's the website, phone number, email. Please reach out if you need help.